Hey guys, thanks so much for popping in, joining us this morning. We're throwing a video together to talk about CPR care for infants and children, right? So pediatric settings, pediatric populations. So remember, when we're doing CPR, usually it's because there's no response and no breathing, right? That's when we do CPR for an individual. A lot of the time what happens in pediatric settings is we have respiratory problems, right? So breathing trouble, breathing problems, and those breathing problems can persist, and they can persist quickly and then convert to or translate to or turn into a cardiac problem, right? So the rule of thumb in general, cardiac emergencies aren't very common in pediatric settings. Usually they're respiratory problems. So when you think respiratory, we want to think about choking, right? So airway obstruction. An infant or a child is choking. We maybe have an issue dislodging the object. It persists, a couple minutes pass, and they now collapse because we could not get the object out, right? So that is what we refer to as a secondary cardiac arrest. So cardiac arrest was onset by something else. And again, these are what are most common in pediatrics. So we have choking. We have asthma, right? So asthma attacks, severe asthma attacks. We have anaphylaxis, right? So we have anaphylaxis with severe allergic reactions. Could be an issue. Drowning is a big one, especially in kids under 5. It is the fifth leading cause of choking is the fifth leading cause of unintentional death in children, right? And again, we have drowning, we have asthma, we have anaphylaxis, and oftentimes we could also have drug overdose. Believe it or not, opioid overdose can happen with pediatric settings in which breathing problems persist, can result in a cardiac emergency. So remember, when it comes to drug overdose or opioids in general, these are not, necessarily street drugs. These can be prescription medications as well. Oftentimes, sometimes accidentally just kind of left out or accessible. So again, prevention is really key here with avoiding that. So it's really important for people to understand. Can a cardiac emergency happen in a child or infant? Yes, it can. Does it happen very common, or is it common? No, it is not. It's usually a result of a respiratory failure or a respiratory arrest that can then prolong and progress quickly into a cardiac emergency. So hopefully you guys enjoyed today's video, understanding a couple differences there between respiratory arrest and cardiac arrest and how that affects pediatric settings. Thanks so much for joining us.